Can an EMT level provider administer nitrous oxide for pain relief in the absence of a paramedic responding to the scene or being present on a scene? A new pilot study was published that looked at this, and it's important to establish that a pilot study is something that's conducted to establish the feasibility of a larger study. It's like working out all the bugs and kinks before you move on to that larger, more informative study. Before we get to the data, let's talk about how nitrous oxide relieves pain. Nitrous oxide is N2O, 2 nitrogen molecules, 1 oxygen molecule. And it's usually administered through a mask that customarily just covers the nose. The short answer to how nitrous oxide relieves pain is, number one, it causes GABA receptors to block some neurotransmission, and that makes you feel less anxious. It also causes the body to release norepinephrine, and when the body releases norepinephrine, it interferes with pain signaling, and it also causes the release of dopamine from the brain, and dopamine causes you to feel very happy. All this comes together to cause you to feel less pain and more euphoria, to the degree that sometimes you actually just start laughing for no reason, which is why they used to call it laughing gas. One of the great things about nitrous oxide is that it's self-limiting. You place it on the patient, and when they've had enough, they just take it off. Back to the paper, this was a 1-year pilot study in a multi-tiered urban EMS system where EMT level providers were the primary providers on scene and had the capability to administer nitrous oxide when the patient was in pain. A total of 165 patients received nitrous oxide for pain. 75% of them reported a significant decrease in that pain, with no one reporting that anything got worse. There were only 2 adverse events reported with its administration, and nothing that would be considered significant. One patient reported dizziness, which can be an expected side effect of nitrous. I get dizzy when I've been given nitrous at the dentist. Another person experienced hypotension with no accompanying symptoms. The EMT providers also recognized the need to call for a paramedic response to administer a different type of analgesic, either because the patient did not respond to nitrous or due to the nature of their pain, they felt that nitrous oxide would not be sufficient. Overall, nitrous oxide was demonstrated to be safe in the hands of the EMT provider, and I will post the link to that paper in my bio.